everyone, my name is Dr. Jane Saparales from BSN2A, a second-year nursing student of Northern Rigor State College of Science and Technology. And for today's video, I am going to demonstrate on how to assess the uterine fundus, fundal massage, and Lochia determination. So fundus, it is the top of the uterine round portion of the uterus, found at the top. It is found higher on the uterus than the entrance of the fallopian tubes on the uterus. It is formally known as the fundus uteri, or known as the roof of cavity. Evolution of the uterus, it is the process of reduction of the uterus to its normal non-pregnant size and state the following childbirth. So lochia, it is the vaginal discharge that occurs after delivery during the postpartum period. This is basically the uterine wall shedding its lining after birth. The uterus is healing and is returning to its original pre-pregnancy size. So the objective of this assessment is to determine the location and the firmness of the uterus. Assess and identify deviations from the norm. So assess and support the women's normal recovery by immediate intervention. Before we do the procedure, we have to prepare all necessary equipment such as the gloves, the perineal pad, and of course, the linen saver pad. After we prepare all the equipment needed, we have to explain the procedure to the patient, wash our hands, and provide privacy. Explanation relieves anxiety and facilitates patient's cooperation. Washing hands prevents contamination, and of course, providing privacy prevents embarrassment and lessens anxiety of the patient. Good day, ma'am. My name is Jane Saparales from BSN2A, a second-year nursing student of Northern Rigor State College of Science and Technology. So for today, ma'am, we're going to assess the uterine fundus, the fundal massage, and Lochia determination. So this is to determine the location and the firmness of the uterus. Would that be okay, ma'am?
Yes.
That's good to hear, ma'am. For us to provide errors, can I see your wristband, ma'am?
Okay.
Can you state your full name, ma'am?
Jane Cruz.
How about your birthday, ma'am?
May 5, 1994.
Okay. After explaining the procedure to the patient, we have to wash our hands to prevent the spread of microorganisms. So now we're done in washing our hands. Now we have to screen the patient or lock the door of the patient's room to prevent embarrassment and of course to lessen anxiety of the patient. Now I'm locking the door, ma'am. After screening the patient, we ask the patient to empty the bladder if she has no voided recently, because a full bladder may displace the uterus, resulting to incorrect position of the uterine fundus. Ma'am, may I ask you to empty your bladder if it has not voided yet?
Okay.
Okay, ma'am. Now that the patient empty her bladder, we have patient to assume in a supine position with knees slightly flexed or dorsal recumbent position. This position relaxes abdominal muscles. Ma'am, can I ask you to flex your knees slightly? So, assuming that our patients are already in a dorsal recumbent position. After placing the patient in a dorsal recumbent position, we have to put on gloves to protect ourselves from any spread of microorganisms and contamination from any secretion. Observe lochia as fundus is palpated. Careful observation can clearly determine any possible hemorrhage earlier. Place one hand on lower uterine segment, using the other hand palpate the abdomen until top of the fundus is located. So one hand is palpate, this one, while the other hand support. This is to determine uterine firmness of the uterine anatomy or bogginess. Supporting hand at the base of the uterus will prevent uterus not to come out of the place, while the other hand palpate the location. While fundus is palpated, so of course we have to lower the perineal pad for us to check if.
So this type of lochia is a normal lochia rubra, since the discharge is a bright red, bloody consistency, freshy odor, temporary increase during breastfeeding and on rising. It is a large, greater than 6-inch stain, or 50 to 80 ml. This actually happened on days 1 to 3. So we determined that the type is Lochia rubra and it is normal. These are the two other types of lochia, which are the Lochia serosa and Lochia alba.
Ma'am, when did you last change your pad?
3 hours ago.
Okay. If it's baggy or the uterus is not firm, then you have to massage lightly in a circular motion the uterus until firm, while the other hand supports the base of the uterus. So this one still supports, and then the other hand will massage lightly or in a circular motion like this. Massage the baggy uterus in a circular motion will promote firmness and muscle contraction that could help expel excess uterine fragments that is still remaining. This is to reduce risk of the postpartum hemorrhage and assess uterus in shrinking back to its pregnancy size. So bagginess is a sign of possible postpartum hemorrhage, which needs immediate intervention. Perform uterine massage every 10 to 15 minutes for the first hour after birth, and every 30 minutes during the second hour after the first 2 hours. This massage usually happens every 4 to 8 hours until discharge. So after that, we determine the height of the fundus, measure height of top of fundus in fingers breadth above below the umbilicus. This is to detect the shrinking back of the uterus to normal size during pre-pregnancy state. After that, we determine whether fundus is in midline point of origin in its umbilicus. So the rationale for this is deviations from proper location indicates a full bladder. We document the consistency and location of the fundus. This helps monitor the condition to normal uterine evolution. Consistency is recorded as fundus firm with massage and fundus boggy. Record fundal height, of course. Example,
On the second day, the uterus is on below or above the umbilicus.
finger breadths below or above the umbilicus. So proper documentation promotes proper intervention that could be done immediately if there is problem noticed on the chart. So after documentation, of course, we make the patient comfortable. This conducive environment enhances healing process as the patient experiences comfort. So after placing the patient in a comfortable position, of course, we remove our gloves and discard it into waste receptacle. And of course, we don't forget to wash our hands to prevent the spread of microorganisms.
So here, discard in a waste receptacle and of course wash your hands.
Now we're done in performing hand washing. As for the evaluation, assessment of uterine fundus has been objectively provided and recorded. Also, the assessment of Lochia has been done and any abnormalities has been reported if it needs interventions.